Hello, my name is Tony Bennett, and I am the President of Bennett Biometrics. The Bennett Biometrics mission statement, the basic Bennett Biometrics process, the advantages of Bennett Biometrics, the flexibility of the Bennett Biometrics process. Our mission statement: to create positive healthcare outcomes by empowering the patient's medical and social networks. It takes a village to heal a person. Provide secure local and global access to patient records for patient and patient providers. Provide healthcare providers with accurate, up-to-date patient information. Provide government with demographic health data and program accountability. Provide insurance companies with process transparency and audit trails. Our process: to create a holistic environment where the patient's health and wellness is at the center of all solutions, both medical and social. To utilize proven, scalable technology solutions from industry leaders that provide the best security, analytics, social media, and crowdsourcing. To give providers a unified tool set that meets or exceeds U.S. and global standards, to include HIPAA, ICD-10, HCPCS, NDC, NIC, and others. To provide patients with user-friendly, recyclable technology that creates independence and not dependence. To develop a 720-degree view of patient care using patient history and biometrics to create demographic forecasting by predictive analysis. To foster more collaborative relationships by identifying information gaps in patient health care and social welfare networks. Our advantage: to provide healthcare providers with unified patient treatment records that meet or exceed federal standards. Enter once, use many. Patient treatment information is shared amongst the patient's provider network. Patient biometric data is recorded to chart patients' wellness in support of care plans. Empower patients with knowledge. Individual wellness plans address patient behaviors. Utilizing telemedicine and teletherapy to give healthcare providers access to patients anywhere. Provide clear reporting of treatment, therapies, and patient outcomes. Provide an audit trail for treatment, therapies, and also patient outcomes. Our flexibility: patients' basic information is entered through existing online social media, such as Gmail or Facebook, or by patient interview. Providers' diagnosis and treatments are shared to reduce over and under treatment, while complementing prescribed patient therapies. Insurance and government payments are streamlined by a pay-by-use model and the healthcare marketplace. An ontologic database responds to treatment conflicts and identifies biometric markers. This project may also qualify under medically unsupported population, rural health and clinic, and lifeline programs for discounted service costs. We also generate real-time patient and demographic analytic reports compliant to federal, state, medical, and insurer guidelines. Our value. Our value to the patient health becomes a joint responsibility of the patient and the provider. Patient wellness is promoted through both social and personal networks. Patients are protected with secure global access to their health information. For providers, patient medical data is accessible globally 24/7, 365. Access to complete federal and professionally compliant app suite. Synergy with existing federal and insurer systems for turnkey implementation. Each interaction provides an audit trail. For government, we generate reportable analytics from any size data set. We provide direct agency access to patient treatment and outcomes at any scale. Target resources and outreach based on real-time data. Frequently asked questions: is this legal? Yes, your medical information is your personal information. What information will be shared? All treatment, diagnosis, prescription, and biometric information is available to you as collected. Provider notes are not. Well, why hasn't this been done before? Well, most systems are compartmentalized. with little external access. Our process places your biometric data at the center of the existing healthcare network. Our trademark process provides role-based data access and guaranteed synergy. Well, why would a provider want this? In-network providers will receive access to patient administrative and analytical suites compliant with federal reporting regulations and guidelines, and it includes an integral billing and payment solution. What's in it for insurers and government? Well, audit trails, real-time analytics and reporting, fraud detection, low cost, and be able to monitor and measure program effectiveness. Thank you. This concludes Bennett Biometrics.